Today, I'm gonna go over 5 hormones that make a huge difference on your milk supply, especially if you're trying to increase your supply or you're struggling with a low milk supply. So the first one I'm gonna go over is the most obvious and the most talked about when it comes to breastfeeding, and that is prolactin, and that's because it literally is the milk-making hormone. It has the root word lacto in there, which is the Latin word for milk. So that's literally its primary function and why, it has the name that it does. But essentially, this could be a concern or an issue if you have low prolactin levels. Now, low prolactin would imply that you aren't able to have enough of the hormone to be able to produce enough milk to feed your baby. Now, these instances aren't too common, but what could cause this is any issue with your pituitary gland, which is a gland in your brain. If you have any type of damage or trauma that happened to your brain growing up, that might be something you want to look into. It also may have been due to any type of hemorrhaging you had during labor and delivery. That can cause a condition called Sheehan syndrome, which damages your pituitary gland, and as a result, it can cause a low milk supply. So if you have any concerns regarding that, definitely check out with your doctor about your history. And then there's also certain instances where your prolactin can be suppressed due to things like a high BMI, or even like if you had some type of like radiation to your brain when you had cancer or anything like that, that could have occurred as well. So that could cause a low milk supply due to low prolactin levels. Another thing that I wanted to address, the next hormone, is oxytocin. This is probably the second most commonly discussed hormone for breastfeeding, and oxytocin is what allows your milk to flow. This is when baby is nursing and it triggers what's known as the letdown reflex, and that reflex is what gets your milk from your breast to your baby. So oxytocin can be suppressed for a variety of reasons, and if it's suppressed, then your milk can't freely go and flow into from your breast to your baby. So without this, you could limit your supply, because even if you have a full supply, you have what's known as the supply and demand theory. I call it actually demand and supply, because really the demand that your baby is putting on your body will indicate to your body and signal how much supply needs to be produced. So if you're not able to properly remove your milk, then you aren't signaling to your body that you need to produce more milk. You aren't going and getting that removal adequately to the point where it says, oh, we're on empty, we need to definitely increase this for the next time. So when that happens, that can hurt your supply over a longer period of time. Ways to kind of go around this is to make sure you have a good latch, first off, that you have, if you're pumping it all in any way, you have the right size or right flange for your pump and it's comfortable, there's no pain, you're not pumping it too high the suction is not too high. It should all be comfortable and there should be no discomfort. That can inhibit your oxytocin. Another one that I would address is low stress is important for oxytocin, and that ties into the next hormone, which is cortisol. Cortisol is the stress hormone, and if you have really high stress, and I know this is so counterintuitive with low milk supply, but if you have really high stress, you can suppress your oxytocin, because that is the relationship that cortisol can have on it. So when you are going through an attempt to try and increase your supply, obviously best practices would be try to minimize that as best as possible, but just know this isn't the end all be all that's going to make or break your supply. It can improve your supply if you're able to minimize your stress, but likely if you are struggling to increase your supply, there are more factors at play here, which if that is the case, we would want to go into some of the more lesser known hormones that actually have a huge impact on your milk supply. So let's go first into insulin. Insulin, honestly, even though prolactin makes milk, I think insulin is probably the most important hormone regarding breastfeeding and milk supply. And the reason is because insulin has a role in glandular tissue growth and mature milk production. So what that means is if you have any problems or issues with your insulin, then you could have not enough glandular tissue, not enough sufficient glandular tissue to be able to produce enough milk. You could have prolactin be totally fine, but if you don't have that glandular tissue, that foundation of the structure of your breast set and, fully developed, then you're gonna have a harder time producing enough milk. So that's why I think insulin is super important, and it really is something we need to talk about more. And then even if you do have the structure in place, it can affect your mature milk production. So that means it can inhibit that process as well. So this is something that I think not enough people understand, that there's a term out there known as insulin resistance. It is not diabetes. You do not have to have diabetes to have insulin resistance. Diabetes is like on the high end of the spectrum. Insulin resistance is on the lower end of the spectrum. It's when your insulin starts having dysfunction in its process and the way that it works, but it's not quite at the diabetic level. So this is actually really common in America right now. There is a high rate of people who have insulin resistance or estimated to have insulin resistance, and it is honestly my belief that this is the biggest culprit as to why we are struggling with low milk supply today. So there's other conditions that insulin resistance can have a role in, such as PCOS. If you have PCOS or a history of PCOS, then you may also have insulin resistance. They have been found to really go hand in hand, and because PCOS can increase your insulin. And so now your insulin is less sensitive when you have PCOS. So it's something you really need to keep in check and monitor when you are someone who has PCOS. So that is just some of the things that when it comes to insulin you want to be aware of. Obviously, double check with your doctor, but this is something that you might want to consider having blood work done for and check to see where you're even at. If this is helpful and you find that this might be something that you need to look further into, please give this video a like, and don't forget to subscribe to the channel. Next hormone I want to address is thyroid. If you have any history of a thyroid condition collectively, then this could be also something that's impacting your supply and causing a low milk supply. So your thyroid can pretty much be either hypothyroid or hyperthyroid. Hypo is when your thyroid isn't producing enough of your thyroid hormones, and hyper is when it's overproducing, in layman's terms. And there's also a condition known as postpartum thyroiditis, which is either one. It could be hypo or hyper, but it's when you are postpartum and you now all of a sudden have a thyroid issue. You may have been totally fine during, pre-pregnancy, during pregnancy, and then something with your hormones that shifted afterwards, postpartum, caused you to have a thyroid condition. So even if you have no history of a thyroid condition, I would highly encourage you ask your doctor to get a full panel of your thyroid hormones tested, so that way you can make sure that postpartum thyroiditis is not something that you are facing. And the reason that this can really inhibit your supplies with hyperthyroidism, we see that oxytocin can sometimes be suppressed. There is, again, back to that theory where if you are not removing enough milk, your body isn't going to get the signaling to increase your supply. So that is why hyperthyroidism can have a role on low milk supply. Hypo, there has been a lot of moms who have reported having hypothyroidism and having a low milk supply. It usually is the milk production that it affects, but there has been studies that are being shown in some animal studies that hypothyroidism can cause also problems with your oxytocin. So it can be kind of twofold in that area as well. Also, this is when things kind of start getting messy and they start stacking with one another. PCOS is possible in conjunction with a thyroid condition, especially hypothyroidism. This is commonly seen with people who have hypothyroidism and then they're obese or have some type of insulin resistance. Then they also sometimes have hypothyroidism. They kind of interconnect, and this is a large part due to what's known as the HPA axis. HPA is your hypothalamus, your pituitary, and your adrenals. So these are all tied in, and there are different parts of your body that have different hormones, but your hormones all interconnect and play a role with one another. So that is why the thyroid issue can kind of almost snowball and, like a domino effect, impact your other hormones and therefore impact breastfeeding, even though your insulin and your thyroid really have nothing to do with your breasts, at least on a surface level. So if that is the case, please follow up with your doctor and see what you may need to have done in order to address these conditions, and do it sooner than later, because it will help you with increasing your supply. If your body's going to respond to anything, it will give you enough time to try and increase your supply, especially before it regulates. So if this video was helpful, like I said, give it a like. Make sure you definitely comment below if you have any questions or are interested in more videos regarding hormones and breastfeeding.